I want to thank you for doing that and encourage you to continue to do it. Every day the situation changes, every day the tension rises, the misinformation flying around the web and the rumors seem to increase. So I hope that every day you can tune in and blood pressure goes down just a little bit. We have the situation well managed here in Rhode Island, and this is the best place to get accurate, up-to-date information on a daily basis about how you can keep yourself safe here in Rhode Island as it relates to our fight against coronavirus. Beginning tomorrow, we'll go back to the 1 o'clock time. It's a standing 1 o'clock press conference. For the past 2 days, I've had to rearrange that, but starting tomorrow, back to 1 o'clock. Today, I'm announcing that we have 33 new cases of coronavirus in Rhode Island, taking us up to a total of 165 cases. And as per usual, I will ask Dr. Nicole Alexander-Scott to address the details of those cases in just a minute. I have a number of things that I need to announce prior to turning it over to the doctor. First, I want to start by talking directly to small business owners. I think in many ways you're the ones getting hit the hardest as we go through this crisis. It has been a precipitous shutdown of the economy, and the economic decisions that I have made have been very, very difficult, and I've made them somewhat reluctantly. I've made them because I have to, because my first job is to keep everyone safe and healthy and alive, but I make them reluctantly because I know the economic pain that a lot of Rhode Islanders are feeling, particularly small businesses, particularly those businesses who aren't used to working remotely, don't have a website to sell what they sell, are used to having an operation that is dependent on people coming into your shop in order for you to pay the bills. So many of you are finding creative ways to keep going through this. Yesterday's news about the Senate reaching a deal on a stimulus package is welcome news. On a call just about an hour ago with the President and Secretary of Treasury, they said they're going to get the small business loans out as quickly as possible. So this is welcome news, and rest assured I'm working every minute of every day to do everything I can both to reopen the economy but also get relief to small businesses, because I hear you and I know how much you are struggling. If I have a special announcement that I'm making now for small businesses who might need a hand transitioning to working from home, selling product online, or just generally helping you to become more technologically capable, which is something that will help you deal with the coronavirus. We are announcing that starting tomorrow, any business, but it's particularly focused on small businesses, can access free tech support via teleconference or over the phone. This is a service that has been coordinated by the Commerce Department, led by Secretary Pryor, and is being staffed by volunteers from some of Rhode Island's leading tech companies, including Infosys, Vertical 6, Brave River, and several others. So starting tomorrow, the tech experts of those companies that I just listed will help you purchase equipment if you need it, help you set up that equipment, help you find software. We've also have Microsoft making donations of software. They're going to help you figure out how to shift your meetings to be online, help you to enable your workers to work from home more easily, help you to set up a website if you need it. So starting tomorrow, help is on the way. We're hearing from a lot of small businesses, even small grocery stores, who just are unfamiliar with this, would love to be able to sell products online, would love to be able to have help setting up a booking system or helping people work from home. So help is on the way starting tomorrow. You could call 521-HELP and get more information about this program for small businesses. I have to say thank you. First of all, thank you to the Commerce team They got this set up in days, but also thank you to the volunteers. We're offering this to small businesses for free because those larger tech companies are offering their services for free. So again, it's Rhode Island at its best, coming together so we can all get through this. I want to make a special announcement right now about New York City, and folks traveling to Rhode Island from New York. As you know from reading the news, listening to the news, nearly half of all of the coronavirus cases in America are in the New York metro area. Over 30,000 cases, positive cases in the New York City area. New York City and the metro area is obviously very, very close to Rhode Island. 2 to 3 hour train ride, car ride, very easy to come from there to here. There's a lot of panic in Rhode Island right now related to folks from New York coming to Rhode Island. And I would like to take a second to respond to that issue and explain to you some new restrictions that I'm rolling out right now in order to keep the people of Rhode Island safe. Later today, I'll be signing an executive order mandating, not suggesting, mandating anyone who has traveled to Rhode Island from New York by any form of transportation must self-quarantine once they arrive in Rhode Island for a period of 14 days. This takes effect immediately, and it also applies to anyone who's been to New York in the past 14 days coming here. So I want to be very clear about this. Earlier this week, I said that anyone flying into TF Green from any other state must self-quarantine when they arrive in Rhode Island for 14 days. That system's going very well. We have National Guardsmen and women stationed at the airport. They have tables. They're greeting you at the airport. They're taking your contact information, and you're being ordered into quarantine. What I'm saying is that specifically with respect to New York State, no matter how you come to Rhode Island, bus, car, train, plane, you are ordered to quarantine once you get to Rhode Island for a period of 14 days. By the way, this is consistent with direction that we're receiving from the Trump administration and from the CDC, suggesting that we follow a course of action, which would say that folks coming from the New York area be quarantined for 14 days. As I say, this will be effective immediately. I understand this is an extreme measure. I believe in light of the crisis, in light of the fact that New York City is a hotspot, their infection rate is skyrocketing, and they are so close to Rhode Island, in my judgment, this is the most prudent course of action in light of the totality of the circumstances. I want to be clear about how we're going to enforce this. We will be stationing members of the National Guard at Peter Pan and Greyhound bus stops and at the bus terminal in Providence. Similarly, at the train stations, there are two Amtrak train stations in Rhode Island. We'll have National Guardsmen and women stationed at the train station. And if you're coming in from New York, we need you to check in and give us your contact information. Additionally, the state police, I have Colonel Manny with me today, the state police will be flagging down cars with New York State license plates as they come into the state of Rhode Island. This is different, this is unusual, this is radical. I believe it's necessary to confront the dangers that we're seeing in the New York City, New York metro area, and the fact that we are 180 miles from there, even closer in some circumstances. The state police are still working out the precise details of how they will effectuate this, but I don't want any surprises. If you're coming to Rhode Island, with New York plates, chances are you will be stopped and you will be asked to provide your contact information. I also want to be very clear about what we're doing with this information. The information that the guards, men and women, are collecting at the airport, at the train station, at the bus station, or that the state police will be collecting on the roads, will only be used for one purpose: the purpose of providing it to the Department of Health so that we can track you and do contact tracing. Will not be used for any other purpose. Police, no other police purpose, no other immigration purpose, no other state purpose. One purpose: public health only. In the months to come, where we need to drive our new approach is to pinpoint risks and then do aggressive contact tracing and quarantining. That's how we're going to get to a place where we can keep everybody safe and reopen the economy. This is the beginning of that sort of an approach where we're trying to pinpoint, contact everyone, and keep everyone safe. So again, it's unusual. I don't want anyone to panic. If anything, Rhode Islanders should breathe a sigh of relief because this is just us doing smart things to keep ourselves safe. If you are a Rhode Islander who's in New York City, you have a house here, come home. That's fine. We'll welcome you home. But when you get here, you are automatically ordered to be quarantined for 14 days, and we need your contact information. I'm likely to have additional announcements in the coming days around further restrictions as it relates to folks coming from the New York area to Rhode Island. I want to take a second to address testing. I am overrun with questions about testing, and I want to address the issue and do it in the most transparent, straightforward way that I can do. We need to ramp up our testing. That's a fact. In order to meet the demands of the crisis, we need to get to a place where we have a much greater testing capability. Right now, we are primarily focusing our testing on high-risk populations and on healthcare workers and first responders. Very quickly, we need to get to a place where we have kind of a ubiquity of very widely available testing, similar to what you see in South Korea. Many people get tested, quickly identified, and then put in isolation as necessary. Our goal, my goal, for our state is that by this time next week, we will be able to be running 1,000 tests a day. That's where we want to get. This time next week, 1,000 tests a day with reasonably rapid results of those tests delivered to people. Today, we're at less than half of that. Our capacity is just about half of that today, between what we're able to run at the Department of Health lab and then other labs around the state, and then leveraging commercial labs. And again, as I say today, our focus is on the high-risk populations. I am asked constantly, Gov, when are you going to reopen the economy? When can we go out to eat again? When can my small business reopen? I cannot reopen the economy until we have a testing infrastructure in place similar to the one that I just described. Multiple testing sites and swab collection sites around the state, and a capacity to run effectively, at scale, reliably, at least 1,000 tests a day. So that's a key milestone that we have to get to before I can even think about safely reopening the economy. Why is that so hard? Because there are so many pieces to the puzzle. And adding on to that, you hear every day about the challenges of PPE, personal protective equipment, masks, goggles, respiratory masks. President Trump has been crystal clear on this. Governors had a call with him today at noon. Governors have been directed to go into the private market and purchase all the supplies that we need. That's actually incredibly difficult to do, especially when we are competing with the federal government And frankly, the United States is competing in those markets with another 120 other governments around the country. So we are working aggressively, but I want to be very straight with the people of Rhode Island about how difficult this is right now. There are many products that we need, and we need every piece of the chain to be in place. In order to have a swab collection site, you need the swabs, you need the kits, you need the PPE, you need the manpower to staff this site, and then, of course, you need the labs to run it. And that entire system has to be running effectively in order for us to do any of it. And we're in a position now where we're essentially going out to fend for ourselves in the global private market in order to procure everything we need. Having said all of that, we're doing a great job. The team is working around the clock. We have several weeks of materials already in hand, and we're working as hard as we can around the clock to set up our own supply chain here. But I don't want to sugarcoat this for the people of Rhode Island. This is a Herculean task, and there's many pieces to it. But now you have a sense of where we're trying to go and what our goals are and all the pieces that have to come together. Not to make light of the situation, but to really try to simplify this. You might think of it as, baking a cake or putting together your favorite recipe. If you don't, you can have as much butter in the world, you can have as much butter as you need, but if you can't get eggs in the right amount at the same time, you can't bake your cake. And that's a highly simplistic analogy. But in order to make this work, we need the machines, the reagents for particular machines, the staff who knows how to use the particular machines with the specific reagents, the swabs. I mean, it's complicated, and we are very far along the way, but I want to just make everyone understand why this isn't something that we can get up and running right away. I also want to put the crisis in perspective. For those of us who are on the front lines, every day feels like a week, and it's actually hard to believe that it was only last Tuesday that I directed the order to shut down restaurants. A few months ago, most of us didn't even know the word coronavirus. Today, we have a test for it. We here in Rhode Island are running hundreds of those tests a day. Right now, in Rhode Island, we are providing distance learning to 140,000 students. We have a statewide response to childcare. We are providing customer service remotely at the DMV, at Department of Labor and Training, and at all of our DHS field offices. We've raised about $5 million philanthropically. Hundreds of companies have donated supplies to us and are donating to our relief efforts. And I would say, although the speed of this virus can be scary for some of us at times, I want you to know the speed of our response has also been incredibly fast. Earlier this morning, right here in this room, our General Assembly leaders moved with incredible alacrity to allow us to borrow $300 million in the private market. So we're ahead of this virus in Rhode Island. We are ahead of it. The people of Rhode Island at this point in time, just take a breath. Go take a deep breath, go for a walk outside. This is challenging. It's a pandemic like we've never faced before. We have a system in place. We have a plan. We have goals. We are not seeing the surge of some other states. Our hospitals are not overrun. And that's where we want to stay. We want to stay a step ahead of it. So it's coming fast at us, but you should have some confidence that the response that we have mounted is also very rapid. And if we can, I have total confidence in our state's ability to meet the needs that will be required to keep everybody safe. One last thing I'd like to mention. As I've said many times, the economic impacts here are devastating and starting to be hard felt by many families. There are many, many vulnerable families who are really struggling to buy food, struggling to buy disinfectant wipes, struggling to pay the rent, struggling in so many ways. Family Service of Rhode Island is putting together kits and items such as disinfecting wipes, hand sanitizer, and they're arranging for pickup and delivery of these kits to families in need. If you're an individual and you're able to give anything from a little to a lot, or if you're a big company and you can make a huge donation to Family Service, I would ask you to please go today to the Family Service website or give them a call. You can also text Be Safe, B-E Safe, to 44321 to donate. So Family Service RI, if you can, give a hand to them so they can get together these wellness packages for our families that are most in need.